There we go. Wonderful. All right. So today we have a bit of a special call, and there's a few of you still coming in. So I'm just filling up a bit of time before we get to the meat of it. But we're having an exceptional call on a Tuesday, and thank you all for clearing your agendas to attend despite the unusual day. And we'll hear from colleagues from Global Fund Secretariat an update on GC7 and the replenishment campaign more broadly. But I think we can get started. There's already a few people in. And Katie, can I give you a floor?
Yes, as soon as I find my unmute button. Thanks. Hi, everybody. It's Katie from GFAN. Really excited for the call today. And as Quentin said, thank you for joining us on an unusual day. We're just trying to make everybody's schedules line up. So we're really grateful that we could make this happen today. And just very excited for the Secretariat to give us another update on the AIDS replenishment campaign and, sort of how everything is unrolling from the grant period for GC7. We wanted to have this call ahead of the International AIDS Conference because, as many of you already know, for example, GFAN will be releasing a paper around a pre-investment case paper around sort of our civil society and community ask around the replenishment. And so we just wanted to make sure that we'd also and appreciate the Secretariat being available to share sort of an update on where they are now, because once we get through the IAS, I'm sure some people will take some well-deserved holidays, which includes myself, but hopefully colleagues from the Secretariat as well, and many of you, before we hit the fall, fall for me anyways in Canada, might be spring for some of you, but before we hit sort of September and we start running with things like the results report from the Global Fund and all of those things that keep us busy through the fall in terms of UNGA and the Global Health Summit, board meetings, etc. And so my understanding is we have a presentation today from colleagues at the Secretariat. We're going to first hear from Diane Stewart from the Donor Relations Team lead, and Françoise, who leads the Communications and External Relations. I don't ever actually get the titles right anymore. I do apologize, but they do change a lot, and I can't quite keep up on your org chart. But ladies that we have heard from many times over the last few years, and we all know that we appreciate their insights. I did just want to give a small apologies on my behalf that I have to leave about halfway through this call because my oldest daughter is receiving some kind of special award today at the school that we haven't even been told what it is, but we have to go to cheer her on. So my apologies to Diane and Françoise and other colleagues that I do have to jump off. But thankfully, as Quentin told us all, we do record these calls and they will be available to everyone, including myself, to go and finish watching. So I believe, Diane, we're going to hear from you first to give us sort of a bit of an update to start us off around your update today. So first Diane and then Françoise, and then we'll open it up for questions and answers. So Diane, welcome and over to you.
Thanks very much, Katie, and hi everyone, great to be with you today. So yes, Françoise and I will give a little bit of an update. I'm going to start off with a little bit of lessons learned, because I know some of you have seen some of the storyline before, but we are actually constantly revisiting our lessons to make sure that we are planning in the most appropriate way for the AIDS replenishment. So everything we're doing is in the context of what we know from the current grant cycle and the current situation, and ways in which we're trying to sort of prepare for all eventualities. So first slide, please. You'll see that we're going to do a little bit of a look back, a bit of an update on our pledge conversion and the context in which we're operating. And then Françoise will pick up on the second half of the presentation, looking at the update on our replenishment work streams, which are now all up and running, and the timeline and next steps for the rest of the year. And we really encourage a lot of questions and answers, so we'll try and be as brief as possible. So firstly, just a bit of a reminder, next slide please, on where we're coming from. Many of you will be super familiar with our past replenishment campaign, but I think it's worth remembering both the structure of the last campaign, where we had a prep meeting based in a virtual prep meeting because it was the end of COVID, and also a prep meeting during which the war in Ukraine broke out. So our last replenishment very much took place in an uncertain world, and we got through it. So that's an inspiring part of the lessons. But it was a very busy period that ended with a very, very big replenishment event at the UN General Assembly, and you can see those big red bubbles as the bookends of our campaign. And one of the lessons from this very busy calendar was that from a fundraising perspective, I think it was one of the times in recent memory where we really were unsure about how much money we were getting, right up until that board meeting in November of 2022. And a big lesson from there was that was cutting it way too close to when we needed to really re-up the grants in 2023. And it also meant that for many of our events during that period, we were doing a lot of outreach, but we weren't really getting a lot of secured funding. And so we learned a lot of lessons for that, and we really want to figure out how to minimize some of the risks around only knowing what our allocation amount would be at the board meeting in November. So next slide, please. Some of the wonderful elements of that busy period that we want to preserve, we're looking at on this slide, right? Firstly, we had great leadership from the US as the host country. We were able to secure a reasonably early hosting announcement on World AIDS Day of the year before the campaign. And we also had secured the leadership both of the US and of 5 African presidents in advance of the prep meeting. So there was quite a lot of political commitment already available to us before we even started the campaign. We also kept up a steady stream of events, and you saw all those blue dots throughout the year. We engaged with the US to host all sorts of things, both at the WHA, in terms of our board meeting, engaging with people throughout the year. And those events, many of which you helped us with, were able to keep up a sort of steady stream of engagement, both of the host, which was really important because they needed to make the asks for all the donors, as well as for all of the partnership. And they maintained that high visibility right up until the end when President Biden hosted the event in New York, if you are aware. Next slide, please. The role of all of the partners and the presidents and the African Union writ large was really, really important as well. And so this political leadership is something we're really looking to replicate for the next replenishment, both in terms of a sort of high profile leader taking responsibility for various aspects of the campaign. And you'll recall that all of the presidents that had committed to the campaign last time did various either hosted events, wrote letters, lent their voice to op-eds or other ways in which they engaged to make sure that the 7th replenishment campaign was a success. So this was incredibly important for also the multilateral nature of the Global Fund, that all of the stakeholders feel a commitment and ownership by sub-Saharan Africa in terms of the ask. Next slide, please. So the kind of commitment shown by all of you and our civil society and communities was really important as well to keep that steady drumbeat of noise throughout the year. The way in which we did this was really to build towards the event at the UN General Assembly. And I think there were lots of good examples of ways in which we pushed out messaging throughout the year. You ran your own campaigns as well. So we had advocacy letters being sent in certain locations. We had actions or campaigns rolled out across Africa, as well as across all of the donor environments. And the civil society representation was really extremely visible in New York. I think one of the lessons here, as we've learned at every replenishment, is that kind of engagement and support is really, really important. And I think we'll be looking for more moments throughout the year. So rather than building to a big crescendo at the final pledging moment, I think we're looking for more peaks throughout the year. And that's something that we're hoping you can really help us with. And you managed that last time for us in a number of locations. And I think if we plan together, we can make sure that we peak in the right places at the right time. Next slide, please. So that moment in New York was really important for political leadership. I think this is a big lesson for us, and we'd love to hear your feedback also on what you think was the best kind of setup for final pledging moment for a replenishment. You can see that communities and civil society were very engaged and were able to meet with President Biden, and many of the other leaders were actually amazingly available to us all, because it was a pretty small room, and the turn-up was great. I think the challenge for us in New York was that it's a very, very, very busy space. And because of the Queen's funeral and other things, I think we were really fortunate to be able to get all of these heads of state in one place at one time. Whether that's replicable is quite a challenge for us. And so I think we'll be looking to see where we think we can have the most impact in terms of getting the most announcements. And as I said, most of those announcements were made on the day last time, which was pretty risky. Next slide, please. So, oh, sorry, I didn't know there was a build, but you all know how much money we raised. So now a little look about what happened since we raised that 15.7 in New York. Next slide, please. Things are going pretty well on pledge conversion for the 7th replenishment. We're very much on track with most of the agreements signed, and you'll see there's more agreements signed than donors, but that's because we sometimes have multiple agreements with donors. But both for public and private sector, we've got the majority of the agreements are signed, and money is coming in per the schedule. So you'll see we've got about 1/3 of the money in, which is about right for where we are in the cycle. And a reminder that, of course, the US, because of the matching requirement, always pays last. So a big chunk of the money comes in towards the end of the period. And you'll see there the 6th replenishment is at 99% conversion. We've got $17.47 billion in cash coming in for the 6th replenishment. So that's pretty exciting. And then we've continued to fundraise. I know that's often a conversation we have with all of you, but the money has continued to come in relatively small amounts, as you can see by this list. But the important thing is that we continue to keep pressure on donors that if ever they've got any money left over, they should give it to the Global Fund. And we've had new announcements as well of new commitments, including an 18 billion commitment from China, which we're hoping to finalize in the next couple of weeks. Next slide, please. So looking a little bit at the context we're facing and the approach we're taking for the 8th replenishment. Next slide, please. You can see from some of the messages I've been passing already that we feel that we learned a little bit from what was in the 7th replenishment process of a very, very difficult global context with a lot of changing issues and a lot of unexpected eventualities. So we expect that kind of volatility to continue. And if anything, geopolitical tensions have got worse. So not only do we have the war in Ukraine, the war in Sudan, the challenges in Gaza, but we have a lot of economic challenges in most of the donor countries, a lot of nationalism and populism in many countries, which doesn't lend itself to increases in ODA. So you see all of the money available stagnating, and what money there is available for ODA is very much in demand for humanitarian response, for food security, for responses to extreme weather events and other challenges that we see. So in terms of the geopolitical context, I think it is extremely challenging. And then, of course, you have the multiple replenishments and asks that are underway in the next 18 months from almost all of our health partners. Next slide, please. So you can see, I know that we've shared this before at GFAN meetings. I think it's always useful to look at what the risks are, and especially what the long-term risks are in terms of what governments and key business leaders are thinking about in the short and long term. And you can see that health does not feature in any of these priorities in terms of what people are worried about and what they think they need to spend time, effort, and money on. So in the longer term, it's all about climate. In the short term, it's all about conflict, insecurity, and challenges to democracies. So we really are operating in a new environment, I would say. And I know from talking to many of you that we're sort of trying to figure out new tactics in the face of these sort of unprecedented conversations that are happening in many of the donor countries. Next slide, please. So I think one of the things that we'll be looking to showcase in our investment case is that there is still reason to focus on the Global Fund's mandate, right? The progress that we have made against AIDS, TB, and malaria is important, and we need to keep reminding ourselves that there has been huge impact and huge progress in terms of reducing mortality from the 3 diseases, but it's not enough, and we are not on track to meet the 2030 goals. And so being able to articulate both the good things, and we have to be careful about being too negative, so we do need to articulate the good things that have been achieved so far, but the challenges that remain is really important. So we'll be trying to quantify those needs and those challenges in the investment case and respond to the fact that we haven't done our job yet. The core elements of the mandate are not achieved. And we have to do that in the context that domestic financing for all of these things is not growing either. And so the fiscal pressure on countries is really important in the face of increasing challenges in health. Next slide, please. So we do have, as I said, some good news around what we might want to do in this current context. So we can't just say, oh, everything is terrible, we haven't met our goals, what are we going to do? We have to look at what are the things we can offer to donors to say, look, we can accelerate and we can meet these goals. So part of this is around all of the innovative new products that are going to be available. And so we're looking at market shaping and other ways in which we can quickly scale up the new tools that are available, whether those dual active ingredient bed nets or the new first line ACTs that are available to combat some of the resistance that we're seeing to malaria drugs. There's all sorts of exciting new self-testing approaches, including the rapid HIV self-test, but also opt-out testing, which means that more people get tested. So there's a lot of new ways of doing business that we think are important and that we will be focusing on. And we are investing significantly in some of the tools that will make things easier to manage, like digital tools and other health information management systems that will allow us to track our impact more carefully. We're also looking at opportunities within the climate and health discussions related to the COP process, right? We know that not enough is being done to protect the fragile gains we've made in AIDS, TB, and malaria and in health systems from the ever-changing climate emergency. And we need to do more on that. So we'll be looking at how to articulate that in the investment case and how we can best protect the programming for AIDS, TB, and malaria from whether it's extreme weather events or just rising temperatures. So we need to look at just basic things like safe storage of drugs and tools and things like that. So some of this we don't have a choice, we have to do it. Others we should be doing more to build resilient systems so that we have longer term sustainability in the work that we're doing. We also need to look at how to bring and attract more money to the fight. We have this conversation regularly with you, as you know, so we're looking at some additional blended financing opportunities. Debt to health has been extremely successful and we want to scale that up. But we need to look at other innovative ways to try and attract more money, whether it's private sector money or public sector money, towards the fight against the 3 diseases and the strengthening of health systems. And then we have some longer term challenges, of course. We're continuing to reinvest our COVID-19 response mechanism money into health systems in a way that will support the fight against AIDS, TB, and malaria. And we're doing particularly a lot on medical oxygen, and other systems investments, including community health workers and community systems, to make sure that that is all building up resilience in the system. And there's a lot of really exciting work going on there, but that is due to come to an end once that COVID-19 money is spent. And so we need to think through how we embed some of these longer term system strengthening issues more clearly within the work that we're doing. Next slide, please. So in light of all of that, what does this mean for our strategic approach to the 8th replenishment? So I've mentioned already all of the challenges in the landscape and the challenges we have with our fellow global health organizations as well, since they're also raising money at the same time as us. So we see those challenges as being important contextual issues, but we faced difficult contextual issues before. And so we need to think about how we tell our story and how we manage the engagement with the people who make decisions about the money to make the Global Fund one of the tools that addresses the concerns they see in the external context. In terms of the Global Fund specific things, these are really things that are more within our control. So what can we do within the Global Fund approach that will mitigate some of these things? So one of these is starting early. So as you can see, we're planning earlier than we did before. We're also engaging very much with the partner countries. And those of you who at the World Health Assembly would have seen we did a lot of events with all of the partner countries, especially sub-Saharan, but not only sub-Saharan countries, to make sure that we are a partner of choice for them and that they are willing to speak on our behalf. We're trying to partner up with Gavi, WHO, and our other partners in the global health space to show how we are complementary and we work together within the landscape, so that it's very clear what role we play in relation to each other and what our story is. We're also trying to move away from that big bang approach that I described that we did in the 7th replenishment, to spread out a little bit our fundraising capacity over the course of the period, and to make sure that we're building as much security and as much knowledge about those pledges as early as possible and locking in pledges as early as possible, rather than waiting until that last minute approach. And so you see us planning earlier with the investment case and the campaign, and Francoise will explain a little bit about what we're doing on all those dimensions to be ready. But most of all, we have to continue to demonstrate our impact, right? That we are the best way for donors to change their dollars into health impact. And I think that's what we'll be trying to do. So next slide, please. I think we are coming to the end of that section. No, one more. Yeah. As we think about what themes we're going to take forward, and we've already been talking about many of these things, as you will have noticed, we have a few elements that we think are really important as we sort of get to the end of this year and then start campaigning next year. One is that we're accelerating our implementation, right? So that the recovery after COVID is really speeding up and we're getting more done and we're getting more impact, and that we're not waiting for the next cycle to start scaling up new products. The bed nets are a good example of that. So we're trying to see if we can get ourselves to a really good position to tell a story as we go into the next funding round. So results, our focus on health systems, which many donors are looking to see. We also need to make sure that we're telling a strong story around human rights, gender, and equity, right? This is a really important piece of our mandate, of our raison d'etre, and we have to be able to show that we are one of the organizations that is really providing a bulwark against the challenges that community, civil society space, and all those things. I've talked a lot about climate resilience. I won't go into that more, but we're finding ourselves constantly having to respond to changing circumstances in country. There's already been several extreme weather events this year. We expect more. I've talked already about partnerships with other organizations, so I won't belabor that point. But the conversation around localization and the Lusaka agenda is going to be very, very important for us going into this next replenishment. We're actively engaged with that, with Gavi and the GFF, to look at what that might look like in terms of adaptation in our model. But we have to keep in mind, and I know particularly with this group, we have to keep in mind that we need to keep our values at the core of that, that civil society and communities have to still have a voice. And when we're talking about localization, we're talking about all stakeholders in country and not just government. And then finally, just to mention in the context of those last three, many of which I've already spoken about, sustainability will be key for the next replenishment. It's already a very important theme with donors this year in Grant Cycle 7. And how we talk about the ways in which we're embedding sustainable practices and sustainable programming in countries is going to be vital for this next replenishment. And a lot of the work that we're doing around strengthening country systems, strengthening financial management systems at the country level to be able to manage these things is really important. So how do we do all of this? Françoise has the answer.
Oh, thanks, Diane, for this wonderful transition. No, thank you so much, Diane, and thank you, GFAN, for coming in this call. Thank you, everybody, for participating. So I'll complement what has been shared already with some highlights on what we have in the works when it comes to the key 8 replenishment work streams. So you can go to the next slide, please, Kansa. Yeah. So we will look at the key 8 replenishment work streams that are already in the work. So as Diane said, we know that we knew we needed to start early, and we are starting early indeed, probably earlier than ever, but it's very much needed. So I'll speak a little bit about a few of the work streams, starting with the investment case, which obviously is the cornerstone of everything that derives in terms of the 8 replenishment narrative and campaigning. So next slide, please. Thank you. So the key piece, as you know, is the investment case, and this time around we have a few things that are kind of as per the usual practice, but also a few things that are new. So in terms of the timeline, first of all, we are on track. What has happened with my sound?
No, you're fine. You're fine.
Okay, I'm fine. Sorry, I got something strange on my screen. So we are on track when it comes to the development of the investment case. We are following the usual practice when it comes to what you can see on the screen: resource projection, modeling work of the impact, etc. But we are also adding a few analyses that derive from the context that Diane has outlined. So looking at the cost and the impact that we aim to achieving in health system strengthening and pandemic preparedness, for example. We are also exploring further the link between climate change and health and the 3 diseases. There are a number of things that are kind of new and we hope will make the investment case richer and more compelling. Next slide, please. We are guided in that endeavor with the Modeling Guiders Group, which is, as usual, a group looking at the convening the modeling teams and institutions. This group met for the first time in April this year. And normally they meet twice a year, so twice in the IC development process, once at the beginning to provide inputs, endorse the key principles, the proposed approach, and so on. And then sort of later in the year, once this modeling work is complete, to kind of review and endorse the results. And this exercise is really important because it's really what gives us the alignment and the coherence of the entire piece, and also the backup from the global partners, from WHO, UNAIDS, Stop TB, RBM, etc., to make sure that we are all on the same page, we are all taking the same assumptions, we are all having the same ambition when it comes to ending the 3 diseases and strengthening the health system. So really, really important exercise to give us all the credibility that we need. And we are building on the best practice and the modeling guidance group that we've been pulling together over the past replenishment. And you see their names on this slide. Next slide, please. So where we are, so as I mentioned, the modeling guidance group met at the end of April and endorsed the key principles and parameters for the analytic work that we have ahead of us. A few things that are important to highlight on this slide are that the resource needs estimate is where we start from, right? We really need to understand what are the resource needs for the fight against the 3 diseases in order to be on the trajectory towards achieving the 2030 targets. And for that, we really take our lead from the global plan, from the global partners. And in that context, the estimates we have at the moment are not fully updated. In other words, we are still waiting for further information in that space. When it comes to HIV/AIDS, UNAIDS has started the process to update resource needs, but we don't have that yet. So we are trying to align closely together with them as much as possible. But the sort of updated resource needs do not exist yet. With TB, they exist, but they have not used the same model that we will be using in our investment case. So again, working very closely together to make sure we have the best resource need estimates as possible. And with malaria, the update we have is coming from 2021, so quite old and doesn't reflect the latest developments when it comes to new tools, etc. So in other words, there's still a lot of work to be done to make sure we have resource needs estimates that are solid. We fully expect them to increase, and I'll speak about that in the next slide. But just to let you know, that's an important part of the exercise. And then I mentioned the additional analysis that we were taking forward that we believe can help our investment case be more solid, more compelling, more credible, and more relevant to the context we find ourselves in. So, for example, we are looking at a new analysis of return on investment and impact of the reduction of TB as one of those additional analyses. Another one that we are very keen and excited about is an estimate of what our investment in fighting the 3 diseases is able to release when it comes to health systems capacity. So the freed up capacity in health systems is something that we hope to be able to add to the investment case. And we have other things in the works, including the impact of our investment in oxygen and others. So hopefully a very rich investment case with some new things and the credibility that is coming from the modeling guidance group. Next slide, please. So I mentioned the resource needs, and I've hopefully conveyed a message that these are still very preliminary and very much subject to change. But yet you can see on this slide the resource needs as they were presented by the technical partners during the modeling guidance group meeting in April. So these are the numbers that they shared with us based on the latest available information. And again, subject to change. There are a few very big variables still to be determined, including the cost for vaccine, for example, for the future TB vaccine is included and is very high, as you can see. But there are still some uncertainties when it comes to when is it that this vaccine will be actually rolled out. We still have also a few things that are not reflected there, such as the impact of climate change or conflict on the funding needs. Similarly, the latest prices when it comes to drugs and commodities are not included. So with all of those caveats, what we know and what we think is unlikely to change is that the resource needs are increasing and have increased since the last period into these upcoming periods in a significant manner. And the other thing that we sort of know, so as you can see, from $130 to $156 billion, these are the total resource needs. Obviously, this is not the ask for the Global Fund's replenishment. These are the total resource needs for the fight against the 3 diseases. And then from there, we start analyzing what are the expected resources that would be available, whether those are domestic or external, before we go into what would be the role of the Global Fund and the contribution of the Global Fund. Obviously, the context, as outlined by Diane, doesn't give us a lot of optimism when it comes to domestic resource mobilization. Obviously, the situation varies across our portfolio, and we will continue to push countries to sustain and invest more in their health systems and the fight against diseases, but we are also very aware of some of the fiscal pressure they are under. So that gives you a little bit of a sense of where we are, what we know so far when it comes to resource needs and potential challenges there. So many of you will probably have the questions as to how does the Global Fund Act look like? We are not there yet. This will come as a result of the full development of the investment case. But we know that resource needs are not going down, they are going up. And also for this group to be aware of, we are hearing consistent messages from our donors asking us to strike the right balance between ambition and realism. So we will have to take that into account one way or another to make sure that the target is stretched, but yet compelling and helpful. Next slide, please. So another, perhaps you can go a few steps. No, okay, strange. Backwards. So another very important key stream, work stream for the aid replenishment. This slide is not coming up right, but it doesn't matter. The thing is that we are starting early also on the campaign development. We are building on the experience and the lessons learned in the same way that, as I mentioned, we've been doing for the investment case, but we are also very much informed by in-depth opinion and analysis and surveys that are informing our thinking, given that the context has changed so much, right? So we can use the lessons that we've learned in the past, including obviously the experience that you have in running the campaigns yourselves and in giving us all of your inputs and advice when it comes to the Global Fund campaign, but we have to do some things differently, given how much the context has changed. So one of the things that, as Diane mentioned, is that we need to be ready for some sort of rolling replenishment with multiple moments and multiple peaks, as opposed to just starting slowly and surely and ending up with a sort of big culmination moment during which everything is revealed and all the money is secured. So the campaign needs to reflect that and have some sort of a rhythm and be extremely flexible. So although you cannot see all the content of the slide, you can see the main message, which is we need to be ready for every moment and really be flexible and agile. Next slide. So one of the key things when it comes to the campaign is to make sure that we can sharpen, in a way, confirm and sharpen our relevance, given the fast-changing context we face. And in order to do that, as I said, we need to be very flexible to make sure that we reach our audiences through different pathways. But one of the things that we are working on when it comes to our positioning and the campaign is to be able to combine the emotional appeal that we know works and is very important, not only for the general public, but for decision makers themselves, and how we make sure that we continue to be conveying this message of solidarity, humanity, togetherness, unity, the values of the Global Fund, while at the same time making a very strong case based on rational arguments. So that was coming in the second part of Diane's last slide: value for money, effectiveness, investing in systems, ability of the Global Fund to respond to crisis. All of those case studies, very well documented and with compelling stories. And then, of course, the third element is the credibility of who is speaking. So being able to elevate the voices across the partnerships, including obviously the communities and the civil society advocates, and making sure that we give a platform and a lot of space for as many voices as possible from the partnership to be heard and bring the credibility of the argument. So this is the approach we are taking, still very much in the works, but hopefully you can see some of those messaging already coming through. We're working around the idea of humanity in the face of crisis. This is not a slogan. This is nothing in stone. but it's sort of the spirit we are trying to shape the campaign around, the humanity that we want, but also connecting what makes all of our decision makers very, very busy and concerned these days, connecting to the world of public crisis that we face. Next slide, please. So you can go to the next slide. Okay, so this is the high-level timeline. Obviously, as we always do, we try to leverage all the key major events that we have in the calendar. So the calendar is extremely busy for 2024 and 2025. We are sort of at this juncture moment between preparation and acceleration when it comes to the replenishment planning. And just as a reminder, the planning is supposed to give us the prep meeting and the investment case launch during Q1 next year, so February roughly, with a pledging conference September, October roughly. All of that TBC. We don't have hosting arrangements secured yet. But in the meantime, it's very busy because not only do we have major events, but we also have a number of elections, hence the high level of unpredictability politically and the need for us to engage with across parties and make sure that we cover a very broad scope of stakeholders in key both donor and implementing countries. And you see at the bottom also the replenishment efforts or resource mobilization efforts of all of our global health partners. So very, very busy agenda where we need to make sure that the Global Fund's voice is heard and distinct and makes a difference. So ahead of us, we have a number of events, and we will be prioritizing very much AIDS 2024 in Munich the coming months, very much a community moment for us. Then UNGA with a high-level meeting on AMR, a very important moment because, as you know, we usually release our results report just before UNGA, early September, and we hope this result report is going to tell a story of success and progress despite the crisis and the challenges. Then World Health Summit in Berlin will be a key moment for partnership, for showcasing our engagement and collaboration with WHO, Gavi, and others. And then, as you can see, in November, it will be a board meeting of the Global Fund. It's scheduled to take place in Malawi. And we will really want to take advantage of that opportunity to showcase African leadership and African partnership with the Global Fund, and to sort of warm up the board members and the constituencies ahead of the launch of the aid replenishment. Next and probably last slide.
That's the results report just flew in.
Yes. So exactly. So on this one, you see the results report with the big star at the top. Next slide. Oh. Okay, so we do have an issue with the slide. Sorry for that. Yes, go a little bit further. One more. Okay, great. So that gives us a little bit more. Thank you. Yeah, you can stop here. That gives you a little bit more content into what I was just saying now. During WHA, which is now behind us, we've been very much highlighting the contribution of the global health system, strengthening PPR, UHC, also climate and health with major external-facing events. So all of that went really well. We have in the next couple of weeks a board retreat to sort of prepare the board to any policy or other changes that they would like to make in order to ensure the most successful possible replenishment next year. We'll be looking at different scenarios and the things that the Global Fund should improve, change, or focus more on. AIDS 2024, I've already mentioned, very much a focus on human rights and gender and communities. And their results report, AMR, and obviously the broader SDG framework, where given that in New York there will be the Summit for the Future, which will take stock on where we are in terms of the SDG agenda and where do we go next. WHS, as I mentioned, focus on partners, but also the Lusaka agenda that Diane mentioned as well. How do we work better with implementing countries and respond to their call for more localized solutions and more owned solutions for their countries, and the board in Malawi, I already mentioned. And then finally, yeah, we are planning to launch somewhere in February. Of course, all of that subject to agreement with potential hosts, with a pledging conference somewhere in September next year, again, pending arrangements with hosts. And I think this is probably it. Next slide, and final slide. Next one. Yeah, great. So in terms of next steps, and this is the last slide we promise, there is a lot of efforts going on when it comes to donor engagement and pledge conversion with huge success so far. We are doing very well with pledge conversion, and we are not taking that for granted. It takes a lot of efforts when risks arise in particular contexts, and we work closely with you to ensure that we mitigate such risks, and we stay very close to our donors, particularly when they are going through elections and sort of political changes. A lot of efforts as well on partnership, engagement, and collaboration. We've been working closely with WHO in preparation for the launch of our first investment round. Last week, we were in Paris supporting Gavi with their own launch of an investment opportunity. We've been signing a number of MOUs with the World Bank, with UNAIDS, with UNITAID, and so on, really trying our best to clarify and showcase how the Global Fund fits within the ecosystem and how this ecosystem is working effectively. Position with visibility, well, this is everything we've mentioned around the narrative, the messaging, and the engagement in major events alongside you and the community and the advocacy voices engaging the Global Fund. And I think the momentum towards aid replenishment is what I've just mentioned with a number of events. Oh, I forgot to mention also the G20 and the G7, two processes in which we've been heavily engaged this year, and we continue to do so with significant success. We've managed to get the Global Fund reference twice in the G7 communique, and we're still working with Brazil on the G20 to sustain a very strong engagement from member states there. So I think I'll stop there, and thank you, and handing over back to GFAN colleagues for the last part of this conversation. Thank you.
Thanks a lot, Françoise. I'm just gonna, because the thing that popped up was me spotlighting you because the sound was coming from somewhere else. Now you're not spotlighted. The eyes are not all on you anymore. Thanks for a really good presentation, Diane and Françoise. We have about 10 minutes for questions, so I don't want to take too much time. I see that we have 2 hands up already. I saw a few questions in the chat. One thing I wanted to highlight, and that was from Diane's part of the presentation about upcoming innovations and opportunities. I noticed that there was no TB vaccine mentioned in it. Is that because it's not integrated in the narrative as of now, or is it in there but just didn't make it to the slide? We can take a few more questions. I'm going to go with Maximina and Robin, and then we'll do a second round for other Robin and Peter. So Maximina, go ahead.
Thank you so much, colleagues, and thank you for the rich conversation with really plans for the 8th replenishment. I think I wanted to just find out from colleagues, probably there's something that we can start to think about around the component around drivers of strategic approach to the 8th replenishment, looking around the issue of localization, like what we discussed before. And I know this topic we usually discuss it, but we've never been intentional about the key issue on absorption of, or the capacity of absorption by countries in terms of the current grant cycle, for example. And I think we have recorded numerous, examples of how each and every country is able to absorb the current cycle of funding, and how some of that funding gets to be reallocated. I don't know if it's sent back to Global Fund or anything like that, but is it something that we can start to look at? How do we also iron out those issues and come up with strategic for countries to be able to to either absorb but also be realistic in terms of what they can implement at the end of the day. In connection to all the conversation here and also, the bigger landscape in terms of financing, I think that's also have a negative effect in some of the resource mobilization efforts. If I'm a donor and the countries are not able to absorb, what does it say at the end of the day? Probably that's along those lines. Do we have we ever have any thoughts probably from the Global Fund team around what are they going to do in terms of that strategy to make sure that the funding is working for the communities, is addressing the key needs of the communities? I know there's issues around structures and systems in place, and some of those structures are the ones that are barriers for communities to then have access to the actual services that we need. Hence, some of the funding then goes back without meeting the actual needs of the communities. So that's just something I wanted to hear from the Global Fund, but something that we can also think if we're looking at the 8th replenishment, for example. Is there some sort of communication do we want to send out to the countries and trying to use the diplomatic voice? I don't know how far that goes, but it's just something that I thought of, that we really need to be intentional about it so that the communities doesn't suffer at the end of the day. So if a country right now is starting to implement GC6, for example, or GC7, GC6 probably, because GC7 is upcoming, what does it mean? So I think those are some of the things that I really wanted to put on the table. Thanks, over to you.
Thanks, Massimina. Just one more question, and then I'll pass the mic back to Diane and Françoise. You go ahead, Robin. So, and
Great.
Robin, I mean.
Hi, everyone. I'm Robin, an independent consultant who fights for what counts, and also the founder of a new not-for-profit and advocacy platform called the Global Sentinels Movement. So last replenishment, I was working at Results Canada and had the pleasure of working alongside a number of different civil society organizations to mobilize 1.2 billion from Canada for the Global Fund. And I just wanted to share, Diane, that one of the things that I think was really critical to our success in Canada was having access to Suzanne. So Suzanne at the Secretariat was in regular communication with us, sharing intel, sharing information, strategizing campaign tactics, providing support, etc. So that was really helpful. And as was the awesome suite of tools and resources and assets that you pulled together to equip us to run with our own campaigns in our own country. So I'm curious, have you started thinking about how you're going to support advocates right now? What suite of assets might become available? And if you haven't started thinking about that yet, I'd love to suggest perhaps maybe a workshop with advocates who campaigned last time, so we could feed in some potential ideas around assets, resources, ways of working together that might strengthen our advocacy efforts.
Thanks a lot, Robin. Diane, Françoise, in whichever order you wanna tackle those.
Sure.
Then I'll take the camera.
Yeah. Okay. Sorry, we are coordinating here. So thank you very much for the very good questions. So a few inputs in response to the first two questions. So Maximina, on absorption, in fact, yes, it is a key element, and of course we cannot. It's very difficult to fundraise and advocate for an organization if the results are not being delivered on the ground. So this is something that we track very, very carefully. We are on track when it comes to absorption. The funding cycle has been moving forward according to plan. So there is no delay when it comes to absorption for AIDS, TB, and malaria programs. Where we don't have major issues, but it's a little bit more challenging, is when it comes to the implementation of health system strengthening elements, because obviously those are a little bit more complex, require more partners on board, and sometimes take a little bit more time to put in place. So the C19RM money that is currently being reinvested in strengthening health systems and pandemic preparedness elements in countries is slightly behind the more core AIDS, TB, and malaria programs and funding, if you wish. So that's something that we are tracking, no red light, but obviously more efforts at the moment being put on the C19RM and health systems investment. Then there was a question on the malaria vaccine, but also a question on the TB vaccine. So perhaps I can combine both. I think one of them was in the chat. So we are closely coordinating with Gavi on such front, obviously. So when it comes to the malaria vaccine rollout, we've been, of course, in touch with them before the release of their investment case to understand the assumptions and making sure the assumptions they are making are sort of compatible with the assumptions we will be making for our own investment case. We are focusing our efforts on ensuring that countries get the right guidance to optimize the use of resources. As you know, the big challenge in malaria is the lack of funding, right? The malaria response is massively underfunded. Therefore, no Gavi, no us, no any implementing country can afford to lose any dollar. So we are focusing our efforts on working with WHO to ensure that WHO will provide more stricter, clearer guidance to countries so that they can deploy the different tools in an optimal way. Because the vaccine is not the silver bullet that is going to fix everything. Rather, it needs to be deployed alongside bed nets, chemo prevention, and other more traditional tools that we have in the fight against malaria. So the alignment with WHO, obviously Gavi and us on that is really important. And then practically, we are also finalizing a guidance note to countries explaining who is going to do what and how. So the parts that Gavi is going to fund, the parts that the Global Fund is going to fund, the parts that we're going to jointly fund, and how all of that is sort of coming together in the most optimal way when countries prepare their funding request, whether it's to Gavi or us. So that's where we are very much focusing our efforts. As I said, it needs to be optimally deployed if we want to continue to save lives against a disease that is massively underfunded and continues to kill so many children in Africa mostly. I'll stop there. Diane, handing over to you.
Thanks, Francois. So maybe just a few reflections. Firstly, on the localization and commentary around absorption capacity and so on. Just to note that we are very committed to making sure that all the money works and delivers impact. So there are constant assessments by the country teams to make sure that money is being spent and money is moving. But before we sort of take it back from countries and reabsorb it elsewhere, we try and address any bottlenecks, especially if it's around community implementation, because we know that there are capacity constraints and we don't like to say, well, if you don't use your money, we're going to take it back. First, we try and see, well, what support is needed and so on. And in fact, we have a meeting with partners later today to look at technical assistance gaps and whether there are other ways we can make sure that money can flow, especially to the frontline responses, to community responses. So we do try and first address the capacity constraints. But if indeed a country is not able to absorb the money, we do have a process called portfolio optimization, which basically means making sure that if a country can't spend that money is reabsorbed elsewhere in the system. And we have prioritized activities that we will spend money on first, and often those are the community-facing activities, or if there are gaps in a country where we didn't have full coverage, and we're able to add some money to another program to make sure that coverage is better. So we do try and keep that very dynamic in most countries to make sure that all the money is spent well. In terms of tools for campaigning, absolutely, we're super excited. We're hoping to get our campaign started a lot earlier than normal. So all of this has moved forward at least 4 or 5 months, if not more, which means that we're hoping to have at least some initial tools ready before the end of the year. And we will, every time we have some element of the campaign ready, we will have a civil society component and set of tools that we'll be able to roll out. So again, I know you're used to getting a sort of package around the investment case and a package once we have our campaign. I think what you can expect from us is smaller packages. So you won't have everything all at once. You'll have small pieces along the way. First, we might have some sort of campaign headlines and key messages, then we might have some assets around community storytelling or other things. So please be ready for those, and we'll provide them. I know there's some questions around financing in the chat. We do not have additional funds for local campaigning, but some of our partners do. So there are ways in which you can get support from partners, and Katie and Quentin are very familiar with this process, so can try and help you connect. And if there are moments where we're doing things regionally or in countries, we do have a process where we will partner with you, and we might have assets to share or events that we can finance in particular countries. So all of that will start to roll out soon. And thanks, Robin, for the suggestion on Canada. I don't have a million Suzannes, but we do have people who will, of course, be engaging in all of the donor countries. I think it's a great idea to get some lessons on what tools you really felt were useful, because that'll guide us also in how we prioritize what tools we make available to you. You know, we love it when you take our bits and pieces and run with them and make them your own. So we will absolutely encourage that. And we very much rely on the local knowledge as well. So ways in which we have different elements of the campaign. And Francoise talked about the results report. The results report will also be quite modular this year. So you can take the piece that works in your environment and expand on that. You don't have to take all the messages all the time. So we'll be trying to give you those sort of Lego building blocks, if you like, and you build the castle that you want out of it. It doesn't all have to look the same. So that's very much the approach we'll be doing. So no big bangs from our side. You'll be getting things along the way that you can run with. Is there something?
Yeah, and
Thanks
I
a lot.
forgot to answer your question, the TB vaccine. We are not ignoring it, and it's actually mentioned in the resource needs for the investment case slide, where currently the resource needs estimate indicates that that will need an investment of $18 billion, which is obviously a very, very, very large number. It's the same as our ask for the 3 diseases last time around. So at the moment, what we are doing is coordinating very closely with partners, with Stop TB and others to figure out what is the actual plan for rollout, to then better tailor how much of that needs to be reflected in our investment case. Is it at the same time or is it coming later? And then, of course, who is going to do what? Because it's much bigger than the malaria vaccine. And you think about the map of the TB burden. So it will be a much bigger challenge for all of us to coordinate around it. So in the works, not ignored at all, and actually actively discussing how much of it and how should be included in our investment case for the next replenishment. Thank you. I didn't want to forget that one. Back to you, Quentin.
And just a reminder, of course, that our next period is 26 to 28. So when you think about new tools, they have to be ready to be scaled by 2028. So the TB vaccine, it's not entirely sure whether it will be ready for that period.
Thanks a lot. We ran out of time. I'm sorry for Robin and Peter. Unless Diane and Françoise, you have time to stick around for 5 minutes? I'm looking for nods or panics. All right.
Sorry, Françoise will have to leave, but I think Pauline, Linda, and I can stay for a few minutes if you want to have a few more questions.
Okay, I just want to, yeah, so Robin and Peter, can you be brief with your questions? Apologies. And thanks a lot, Diane, for sticking around. And sorry, Françoise, that you have to leave us. Thank you a lot for joining.
Thanks, Conte.
Thank you.
And thanks, Diane. Just quickly, so just quickly, in terms of, I just wanted to support what Maximina was also saying in terms of intentionality. And I put a little bit of it, my question in the chat, and I haven't really heard a response to that. I think, and I'm going to push here a little bit. I think one of the things that has really been missing from the story so far in the results reports and in the previous investment cases, which have been really solid and terrific, but it's missing that community narrative and all of the assets, expertise, and results that come as from investments in community-led responses. So the request would be, especially given two things. One, we're wanting to tie this to the Global Fund strategy. And in that strategy, there are two specific objectives that directly relate to community-led responses. And also the third one in terms of health systems, but also in terms of looking forward to grant cycle 8. It would be really helpful to have an additional benefits analysis to that list that you had listed in one of your slides, a benefit analysis about the impact of community-led responses in the Global Fund's overall impact to the 3 diseases. I think it would reset the narrative and really focus in again on the importance of communities and people at the center of the Global Fund strategy. But it would also have incredible impact and value in terms of being able to raise the Global Fund's diplomatic voice in terms of the rollbacks and backlash on civic space and human rights, and the importance of ensuring that communities are funded for the interventions that we know that work. So sorry, I have to jump off for another call. I just really wanted to make that point. Thanks.
Thanks, Robin. Peter?
Thank you very much. I wanted to see how, I didn't hear how the alignment of the replenishment is with the Lusaka agenda, because there are 5 major shifts in the Lusaka agenda, and one is localization, which was mentioned, but the other one is the pooling of resources by the Global Health Institutes. That means they would be pooling all the resources in the country in one pot, and then also using the government system. So I don't know if that alignment will also mean that the PR2 and the PR2s are going to be obsolete.
Thanks a lot, Peter. Very curious question for the Lusaka agenda. Go. Please, Diane.
Thank you. Well, a much longer conversation, which maybe we can pick up with everybody at the next call. But just to say, of course, we are engaging on the Lusaka agenda. In particular, we have a number of work streams together with Gavi around country engagement, around working together on the malaria vaccine as a proof of how we can better work together. And thinking about how to co-invest on health system strengthening and other things. So there's a lot of very active work on that, and our teams are engaged with countries about exactly what the implementation of that Lusaka roadmap might look like. Just a reminder that we are in the second half of a 6-year strategy, and it is our 6-year strategy that governs the priorities and the way in which we implement things. And Peter, things like, pooling all the resources at the country level are not currently part of our agreed strategy. It also, in many cases, very much challenges the idea of the issue that Robin raised, which is community-led responses, civil society-led responses. If all of the money is pooled and given to the government, our experience has been that not all of that money will flow very easily to civil society. So for us, we would need assurances that community-based, civil society-based, community-led responses would be part of any approach that a government was taking if we were to pool any resources. So that's a country-by-country conversation. We're having those conversations with countries, but just to be very clear that we have some caution around how we would implement Lusaka, and we want to take that very carefully and deliberately with countries. But as you know, we very much prioritize country ownership. That is part of the Global Fund model. But for us, country ownership is government and civil society and all other stakeholders, not just government. So I think that's an important distinction we have to remember. And of course, noted on Robin's point around community-led initiatives. And of course, that will be part of the story we will be telling in the investment case.
Thank you very much, Dan, for taking the time and sticking around for an extra 10 whole minutes. I'm not going to take any more of anyone's time. Thank you so much all for joining us and sticking around past the hour. We'll see you all in 2 weeks. We'll talk about AIC and and many more things. It's very late here. Thanks a lot, Diane. Thanks a lot, Pauline, the rest of the Global Fund Secretariat team for joining us. And thank you all for your great questions and discussions. See you all later. Bye-bye.
Thank you.
Bye.
Bye.
Very